Hi, 11th April is National Safe Motherhood Day and we are celebrating it for this entire coming week. Now, what is Safe Motherhood Day? Basically, it just means that for women who are expecting, we want them to have a healthy pregnancy, healthy delivery, and post the delivery she should be happy and stay happy and healthy for the sake of her child as well. So what is important here? We must make sure that we have enough antenatal visits to the doctor. It is important, whether it is urban or rural areas, that we have at least 4 to 5 antenatal visits even in these COVID times. During this time, it is important that we take care of our nutrition, we take care of our health, we take care of our hygiene. It's important to sleep adequately, and it's also important to take our vitamins and minerals that are prescribed, a high protein diet, adequate sleep, exercise enough. During this time, the doctor can also make out if there are any high risk factors which are there. The most common reasons for maternal mortality all over the world, especially in the third world nations, are hemorrhage, anemia, infection, and also some of the problems like lifestyle issues like high blood pressure and eclampsia. So during this time, it's enough time for your doctor to get to know in case there is any problem or any high risk factor, and to address it in the same way, and to also give you tips so that you have a healthy delivery. Now, coming to the time of the term, during this time, make sure that you discuss the delivery options with your doctor, whether it is going to be a normal delivery, whether a cesarean will be required, whether you want to go in for a vaginal birth after cesarean section, or whether how things are going to change, whether it's even going to be an epidural or a painless delivery. And always remember that in obstetrics, things change within minutes. So you must have a good talk with your doctor and decide what is going to be the mode of delivery for you, so that there is no problem during the time of delivery. There is blood also which is arranged in case it is required. You take care of any possible infection, and you take care of whatever problems are anticipated or even unanticipated. Make sure you deliver in a good center. For rural areas, make sure that you at least deliver in a center which is equipped with all this. And for urban areas, of course, like ours, make sure that it's a center which is also equipped to do a cesarean section within minutes if required. Post delivery, we must make sure that there is no bleeding which is excessive. We must take care of infections, and we must take care of any problems that are carrying on from the time of pregnancy. So make sure that we are happy, we are healthy, we are safe, because a safe mother ensures the safety and the importance of progress of a nation as well, because a safe mother is ultimately the harbinger of a safe generation of healthy babies.
Hi, my name is Aditi Sabharwal and I'm a new mom of a 6-month-old baby boy. So my first trimester of pregnancy was basically just all about nausea. I know there was lockdown and COVID and the rest of that happening, but for me it was just one big nauseous blow. And the best thing about Dr. Shelly around those times was that because of COVID, because of lockdown, she wasn't making me come in too many times. She wasn't unnecessarily having me visit the hospital unless I really needed an ultrasound or something. So she was available at all times on WhatsApp or phone calls that trouble her, and somehow she'd always be able to pinpoint exactly how to solve my problem, be it like nausea or sleepless nights or whatever it was. So it was great for the initial 4 months to just have someone to quickly solve the problem, because when that nausea hits you, you just can't take it. And so that's pretty much my first 3-4 months, and after that I gradually eased into the whole being pregnant of it all, and I think what most people should understand when they're pregnant is that it's not your body anymore. You're sharing that space with another person growing inside you. So what we look for is what our body used to be and the stuff we used to eat and the way we used to move and exercise, but that's not the case anymore, and we just have to be patient and allow those changes to happen. So the hormones hit, and there's the weight gain and the appetite changes, and the mood swings and the rest of that. So the whole journey is just a culmination of it all, and I think I somewhere decisively said that now I'm just going to enjoy being pregnant. Prior to being pregnant, I was a super active person. I was playing sports, I was exercising, I'm a lawyer, so I'd keep really late hours, and so life basically became really fast paced at a point. And maybe it's lockdown, maybe it's being pregnant, but I finally got to just gather myself and slow down. And if that meant putting on weight, I was like, let it be. I'm sure I'm going to lose most of it when I deliver the baby. And of course, Dr. Shelly always advised me to eat right and exercise. Other than that, she never really put restrictions on me. She never scared me about the situation. With her, it was more of it is what it is with COVID. And the best you can do is keep yourself happy. She made that a real point, to keep myself happy, listen to music, do yoga, calm myself, and just stay safe. So exercise, eat right, and even with food, I think she let me eat anything I wanted to, but it was always with the disclaimer that yes, you can eat all of this, but you are going to feel sick later, so just be wise and judicious with what you choose. So I think around maybe the 7th, 8th month, Dr. Shelly recommended maybe doing some prenatal yoga classes with someone who actually knows what they're doing, vis-a-vis just looking at random YouTube videos, because I sometimes end up doing that. But I would not recommend that, because it's just better to go with someone who's certified and is dealing with this particularly. And so she recommended Dr. Mahima to us, and we signed up for sessions with Dr. Mahima for her birthing classes, and she gave us many exercises to do to just keep the body ready for delivery, keep it limber, supple. She told us a couple of things to eat right, a couple of particular ways to exercise when you become that big in those last few months. And it was a blessing, really a blessing, to have her even do those video conferences at that time, and to give us that time and be there to help us through the last leg of it, because I think that gets very difficult when you're so big and you want to move around but you can't. And she stressed that at that point is most important to exercise. So she made it a point to say you walk 20-30 minutes a day if you can, like push yourself, because it'll be easier for you to deliver the baby. It's healthier for you, healthier for the baby, good for your body, all the rest of that. So thank you to Rosewalk, thank you to Dr. Shelly, thank you to Dr. Mahima, and thank you to all the staff and the didis and the nurses and the guards outside. Even they are so helpful. So just a big thank you to everyone, and just stay safe and hope these difficult times pass us.